A phobia is a type of anxiety disorder that causes an individual to experience extreme irrational fear about a situation, living creature, place, or object. The fear of clowns is called coulrophobia. It's not yet has an official diagnosis inside of the Diagnostic and Statistical Manual of Mental Disorders 5th edition, which is the manual used by professionals to diagnose a phobia, but it has been mentioned in the specific phobia group. According to a survey made by Chapman University, 7.8% of Americans have coulrophobia. The symptoms of coulrophobia is nausea, panic, anxiety, shaking, dry mouth, difficulty breathing, increased heartbeat, intense emotions such as screaming, crying, or becoming angry at the sight of seeing a clown. From the definitions of phobia, phobias can happen because of a situation or a traumatic event you learned it while young, genetics, or long-term stress. In the case of coulrophobia, seeing too many scary clown movies can have an effect. Also, the makeup they use can be disturbing. Experiencing a bad situation that had a clown involved, or learning it from someone you love or trust, which is not common. So, if you have a coulrophobia or any type of phobia, how to treat it? Avoiding it is not a solution, as avoiding will make your fear worse over time. Most phobias are treated with a combination of psychotherapy, medication, and at-home remedies or techniques. Psychotherapy like exposure therapy, which uses what you fear in a non-threatening and safe environment, or cognitive behavioral therapy, which changes the way you think about your fear to a more positive or neutral way of thinking. So, if you have a phobia, don't be afraid to ask for help. The Anxiety and Depression Association of America offer a useful resource for locating a therapist. They also offer a range of talks on how to overcome specific phobias. You can check the link in the description below. Subscribe for more videos, turn on post notification, like the video if you do. Thanks for watching.